In 2010, the biggest change to American healthcare took place with President Obama's passing of the Affordable Care Act, also referred to as Obamacare. This passing fulfilled a democratic promise to American people, and it took nearly 100 years to do so. This act was passed without Republican support. The Republicans, under the current Trump administration, have been unsuccessful at repealing and replacing the ACA. Their attempts to do so fall under what they refer to as the American Healthcare Act, which aims at making critical changes to the Affordable Care Act. This bill was passed by the House, but not by the Senate. In a nutshell, the Affordable Care Act has three main goals. Number one, make healthcare affordable and available to more Americans. Number two, lower the uninsured rate by expanding public and private insurance coverage. And number three, improve the quality of healthcare delivery to decrease the overall costs of care. So let's see how this democratic view that is currently the law of the land compares with the Republican proposals. An online health insurance marketplace was created by the federal government so that individuals and business owners can easily purchase the health insurance coverage that meets their needs. Medicaid was expanded to help people and families making up to 400% of the federal poverty line purchase insurance coverage. Obamacare expands Medicare coverage for the preventative care and the lowering of drug prices. Republicans wanted to put health care in the hands of private companies and states. Under the ACA, there are no limits to how much insurance can be used in a lifetime. And if repealed, annual lifetime limits will be capped, potentially destroying a person's financial security as well as threatening access to health care. Under the ACA, higher premiums based on gender are prohibited. Also, adult children up to the age of 26 can be covered under their parents' policies, an element agreed to by Trump. Insurance cannot be denied for Americans with pre-existing conditions. Under Trump's proposal, those with pre-existing conditions would be subject to higher premiums. No copays for preventative services. This means you can have a yearly physical without any out-of-pocket expense. This is huge. In June 2019, Trump signed an executive order for hospitals to publish costs for service they provide. This aims at reducing healthcare costs by increasing competition and allowing customers to shop for health services. The Affordable Care Act provides new patient protections that gives you greater control over the care you receive. These new protections require insurance to use plain language to explain your benefits. They also must provide a glossary of definitions so that you can make informed decisions on the coverage that's best for you. President Trump's most favored nation deal is an executive order that ensures that the U.S. will get the same low drug prices Big Pharma gives to other countries. It also focuses on reducing costs for elderly patients and people on Medicare, requiring that they pay no more than any economically comparable country. Joe Biden, if elected, will seek to lower Medicare age from 65 to 60. He will also work to give Americans a choice to purchase a public plan such as Medicare. He will build on the Affordable Care Act by giving Americans more choices and by making our system less complicated to navigate. Biden will stand up to the abuse of power by the prescription drug corporations. He will repeal the law that currently bars Medicare from negotiating drug prices with drug manufacturers. Not being able to negotiate means they can and do charge whatever they want. What will President Trump do? I wish I could give you a clear answer. He tells us what he thinks Biden will do and everything Obama did wrong, and that his administration has done an incredible job on health care, and they're going to do it even better. So stay tuned. That's a really good question. Yes, I think there's a healthcare crisis in our country. You think about how many people are struggling to pay the bills, not knowing if their pre-existing condition is covered by insurance, multiple insurance companies. We have the Affordable Care Act, and a friend of mine who has a 24-year-old son, just been diagnosed with cancer, was thankful that he had some insurance. He no longer works for an organization that provides health insurance. We're in trouble in this country. I keep hearing that the Republicans are going to come up with a great plan. Who knows if they're going to win the election? But I haven't seen any kind of plan. All they talk about is we'll protect pre-existing conditions. I'm an old man. I'm worried. I need to be able to insure my family, my kids, and so forth, that I'm not going to be destroying their lives because my health is suffering, and it may cost them a fortune if they're lucky enough to make that decision. We need some honest discussion about how everyone can find a path, whether it's through their employer or through some kind of national policy like the Affordable Care Act, that'll protect people, provide them with proper treatment and care for their health concerns throughout life. I'm greatly concerned that we have spent so much time talking about other issues that we can't just get it together in this country to make it a reality for so many people that worry about health care all the time. The solution to healthcare reform isn't easy, but it lies somewhere in the middle of these ideologies. The Affordable Care Act was passed without conservative support, and now, 10 years later, the country is on the brink of another healthcare overhaul. Unless politicians work together reaching a middle ground, it's unlikely that reform will be effective, regardless of who's in charge. Considering the coronavirus, all the issues that we have, I still think that healthcare for the general population, for all legitimate citizens in this country, is the most important issue. All I can say now is na zdrowie, which means to your health in Polish. Jeszcze Ameryka nie zgubiona. Twój głos jest bardzo ważne,